Hey, what's up, everybody? Tim Albrecht here, and welcome to this week's episode of the Ask a YFP CFP segment of the Your Financial Pharmacist Podcast, where we feature questions from you, the YFP community, to be answered by one of our very own fee-only certified financial planners. Please note this podcast is intended for educational purposes and should not be considered financial or investment advice, as we do not know all the variables to one's personal situation when answering a question. Before we jump into today's question, a shout out to our extraordinary YFP financial planning team that makes this segment possible. Your Financial Pharmacist offers fee-only comprehensive financial planning services that are customized to the pharmacy professional. So whether you want to pay off your student loans, make the right investment decisions, or simply build a solid financial plan, we'll help get your income working for you rather than the other way around. You can learn more by visiting yfpplanning.com. Again, that's yfpplanning.com. Okay, this week's question comes from Tiana in Portland, Oregon.
Hi, this is Tiana from Portland, Oregon, and I was wondering where you find affordable health benefits when you don't qualify for them through your employer.
Thank you, Tiana, for submitting your question to be featured on this week's Ask a YFP CFP segment of the Your Financial Pharmacist Podcast. Tim Baker, what are your thoughts?
Yeah, it's a tough one. Health insurance, I feel like I would definitely say, full disclaimer, not an expert in purchasing healthcare or health plans, especially with the Affordable Care Act and how that's changed over time and the marketplace. But typically when I see this situation, I typically see it for a few reasons. One is a client is working part-time, maybe in a variety of different jobs like organizations. So typically if you're a part-time employee, the employer doesn't necessarily have to offer health insurance or doesn't offer it or opts to not offer health insurance, even though they do offer it to full-time employees. Or if, you just work in a certain organization that doesn't, I see this mostly in the independent channel where they won't offer a health benefit. So basically the place, Tiana, that I really direct you to is the healthcare.gov website. And I actually went through this myself just to kind of test it out and test it in Maryland. So, basically I went to the website and navigate. I think you put in your zip code and there's some information about you, your age, and obviously your zip code and what state you're in. But then if you go to the doctor a lot, et cetera, your income. And for Maryland, at least, they have their own website. And then they basically, after you put in information, they come up with almost like quotes. So I looked at, for Maryland, they have, a Care First, HMO, like a bronze, a gold, some that are basically have dental plans as well. And it outlines, pretty comprehensively, like, hey, this is what we estimate your monthly premium to be, your annual deductible, which is essentially the most you'll pay or the amount you owe for covered healthcare services each year before your insurance starts to basically kick in and pay. Out of pocket, your annual out of pocket maximum, which is essentially the most you'll pay each year before your insurance basically takes the wheel completely and pays 100% of the covered expenses. And then things like copay, and if it's HSA qualified, and the yearly cost estimate. And I think for the most part, a lot of states are like this. Now, I tested the same thing for Ohio, but I think actually Ohio is one of the states that has a federally facilitated exchange, meaning like the federal government does it. And I think it's all basically on the healthcare.gov. So for me to be able to do that, I had to put in a lot more. I basically had to create an account versus like the Maryland where you can get like estimates. So depending on what the state, so you're in Oregon, you would basically put in that information and see if you go to an Oregon website or if you, go to use the federal system. But for the most part, that would be the kind of the hub, is the healthcare.gov website. And there's a lot of information on there in terms of like, when you can enroll and, what's your eligibility and if you have savings. But, this is something that I see not as frequently, just because most of the clients I work with are, W-2 of, a community pharmacy chain or something like that, or in a hospital system. I typically see this more in like the independent channel, or again, if you're just, working part-time hours and kind of piecing your employment together, sometimes we see this. But that would be the number one, place I would go, is to kind of navigate healthcare.gov and figure out the exchange from there.
And I think too, Tim, don't want to get political by any means, but obviously we're in an election year. We've got a Supreme Court decision coming up that could impact the ACA. So I think for folks that are navigating this as an option through healthcare.gov, make sure you're obviously staying up to date with what's going on and how that may or may not impact what you're looking for. Tim, the other thought I have here, I remember, often you might hear commercials for some of the health share ministries that are out there. And I don't know if you've had any experience with clients navigating these. I know, so essentially, as I understand them, they're more of a pooled, resource rather than what you'd consider more traditional insurance, and may or may not be a good fit, but also may or may not align with somebody's beliefs or whatever that ministry is focused on. Have you had any experience with those with clients?
I have not. It's definitely something that we probably need to do a little bit of a deeper dive just to see if that's another resource that, and maybe we do a podcast or we kind of do another Ask a YFP CFP just to kind of dive into that. But I haven't personally, either in my own personal or even in some of the work that we've done with clients, have seen, those at play, but definitely maybe something we should explore.
Yeah, from what I know of them at a high level, obviously generalizing here, I think they can, especially compared to some of the ACA rates, may be a little bit less expensive, but obviously may not have some of the same guarantees and things around coverage that come under an ACA plan. So certainly you may get something in terms of price, but may lose other things. So worth further looking into and evaluating, and certainly a topic that we likely do need to talk more about in the future. So thank you, Tiana, for submitting your question to be featured on the show. And as a small thank you, we're going to be sending you a super comfy YFP t-shirt. And to the YFP community, if you'd like to have your question featured on a future episode, please go to yourfinancialpharmacist.com/ask YFP or shoot us an email at info@yourfinancialpharmacist.com. Have a great rest of your week.